Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top news. Supreme Court. No doubt NEET paper leak took place, Sanctity was compromised. While addressing pleas for the cancellation of the National Eligibility and Entrance Test undergraduate NEET UG 2024, the Supreme Court acknowledged on Monday that a paper leak did occur, compromising the exam's integrity. However, recognizing that cancelling the entire exam could impact 24 lakh students, the Apex Court, led by Chief Justice of India, has directed the National Testing Agency and the Union government to identify potential irregularities and determine if the leak was systemic and who the beneficiaries might be. Supreme Court suggested the possibility of a limited retest for those identified as beneficiaries of the paper leak. The court also requested updates from the NTA and the government on measures taken to identify the leak's beneficiaries. Additionally, the Supreme Court has instructed the CBI, currently investigating the leak allegations, to submit a status report by Wednesday. The court advised the government to establish a multidisciplinary committee to prevent future paper leaks. If such a committee already exists, the court requests its detail. The case is scheduled for further hearing on Thursday, July 11, 2024. In the meantime, the court has asked all petitioners' counsels to submit a consolidated document not exceeding 10 pages. 13 UP medical colleges face MBBS permission denial by NMC, state to file appeal. The NMC has denied approval of 13 new medical colleges in Uttar Pradesh for starting MBBS courses, prompting the state government to plan an appeal. These 13 new government medical colleges intended to add 1,300 MBBS seats were found lacking in infrastructure and faculty strength during inspections. Currently, Uttar Pradesh has over 10,000 MBBS seats. The new medical colleges are located in Sultanpur, Kushinagar, Kaushambi, Kanpur Dehat, Lalitpur, Pilibhit, Auraiya, Sonbhadra, Bulandshahr, Gonda, Bijnor, Tondali and Lakhimpur Kheri district. The NMC also denied permission to 58 other medical colleges across the country out of more than 100 applications. Partha Sarthi Sen Sharma, the Principal Secretary of Medical Education, confirmed the plan to appeal to NMC. Appeal under relevant provision of the Act by respective principal will soon be made, he stated. Director of General Medical Education Kinjal Singh added, the minimum standard of requirement for MBBS were updated in 2023. We are working on the situation and within 15 days we can make an appeal with the NMC. If the appeal is unsuccessful, the Uttar Pradesh Medical Education Department may file an application with the Union Health Ministry for the mandatory letter of permission to admit students. Kottayam MCH performed successful liver transplant on 5-year-old. In a landmark medical achievement, the Government Medical College Hospital in Kottayam district has successfully performed its first pediatric liver transplant surgery. According to reports, the intricate surgery was conducted on a 5-year-old child suffering from severe liver ailments. Health Minister Veena George, in statement on Saturday, highlighted the rarity of pediatric liver transplant in government hospitals, emphasizing the complexity of such liver surgeries. The operation was superheaded by Dr. R.S. Sindhu, head of the hospital's surgical gastroenterology department. Minister George recommended Dr. Sindhu and her dedicated team for their exceptional work. The team included Dr. Latha, head of the anesthesia department, Dr. Jay Prakash from pediatrics, and Dr. Sajita from radiology. Additionally, the expertise of 2 doctors from Amrita Institute of Medical Sciences in Kochi, Dr. Sudhitran and Dr. Unnikrishna, was instrumental in supporting the transplant procedure. Both the recipient and the donor have successfully been taken off ventilator support. However, experts know that the true success of the transplant will be determined after the highest risk period has passed, as acute cellular rejection can occur within 5 to 30 days post-transplantation or even later. This milestone surgery underscores the advanced capabilities and collaborative efforts within the medical community in Kerala. Tripura HIV case, 47 students dead, 828 positive cases. A recent report from Tripura State AIDS Control Society has revealed that 47 students have died from HIV in Tripura, with 828 students testing positive for the virus. According to a senior TSA-CS official, we have registered 828 students who are HIV positive. Out of them, 572 students are still alive, and unfortunately, we have lost 47 to this dreaded infection. Many students have migrated out of Tripura for higher studies in prestigious institutions across the country. The Tripura AIDS Control Society has identified students from 220 schools and 24 colleges and universities who are involved in injectable drug use. This data was collected from 164 health facilities across the state, covering almost all blocks and subdivisions. As of May 2024, the total number of active HIV cases in Tripura stands at 8,729, with these individuals registered at the ART, that is the antiretroviral therapy centers. Of these, 5,674 people are reported to be alive, including 4,570 males, 1,103 females, and one transgender individual. But Acharji, a senior official, noted, in most of the cases, the children belong to affluent families who are detected positive to HIV. There are families where both parents are in government service and don't hesitate in fulfilling the demands of the children. By the time they realized that the children fell prey to drugs, it was too late. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.